Call to order. Chrissy, would you please call the roll?
Calling the roll, Mr. Jones,
Here?
Ms. Conwell,
Here.
Ms. Brown,
Here.
Mr. Schramm,
Here.
Mr. Miller.
Here.
We have a quorum.
Great. Chrissy, has anyone signed in for public comment?
No, Mr. Chair, no one has signed in.
All right. Can we have a motion for approval of our minutes from the October 21st meeting?
Second.
Moved and seconded. All in favor say aye.
Aye.
Our minutes are approved. All right, well, we have one item on our agenda today, and RQ to Maximus Human Services. And Director Merriman, if you'd like to present on this item,
Would you like me to read it into the record?
please do. Thank you.
Resolution 2015-0235, making an award on requisition number 33447 to Maximus Human Services in the amount not to exceed $1,372,804.51 for the Work Experience Program for Work Required Public Assistance recipients for the period 1/1/2016 through 12/31/2016.
Thank you. Director?
Good morning, David Merriman, Cuyahoga Job and Family Services. I'm here on behalf of our team. We're bringing forward a proposal to enter into a contract with Maximus Human Services. This is to provide JFS with our work experience program. It's a one-year contract with options to extend based upon performance. The contract is valued at $1.3 million, and we have the principal objective here is to provide our cash assistance recipients with work experience activities that will enable them to meet the required work participation metric that is a requirement of TANF, as well as develop professional skills that will be meaningful for them to get jobs. I'd like to talk a little bit about the process, the service, as well as provide you an update, because I was before this committee not so long ago request an extension for a provider. And so I'd like to close the loop on that, and maybe I would actually start there. I think you'll recall that I came before this committee within the past quarter requesting an extension of the ResCare contract because the county was tracking the policy changes that relate to the Comprehensive Case Management Employment Program. And at that time, I requested the extension so we could continue with ResCare through this final quarter of the year, completing our procurement and tracking what the state was looking to accomplish with the Comprehensive Case Management Employment Program. That program is set to begin in July of next year. And we are continuing to partner with the Ohio Department of Job and Family Services to prepare for its implementation and to make changes. And I still expect additional changes will result in the implementation process. And we also are expecting some information from the state or federal government on the state's request for a waiver that would have an impact on all of JFS, but especially on the work participation program that we'll be discussing here today. So our extension was granted through the end of this year. We will continue to use that extension that provider, ResCare. At the end of this year, ResCare will no longer be our provider for work experience, and Maximus will be. And so let me now tell you a little bit about how we selected Maximus. Although we were aware that the Comprehensive Case Management Program was in proposal and was an interest of the states, we felt it prudent for us to do an RFP to select a new provider for moving forward. So Bob Math and his team released an RFP for the Work Experience Program. I have Bob here with me today, and I'll invite him up when I'm done to answer questions in case there are specifics into the project or the procurement. Their procurement closed in the late spring, May 15th. They reviewed the proposals, and we actually paused selection for a period around the time of the state's decision to recommend in the budget process the Comprehensive Case Management Program. Our thought was if the state was going to require us to implement CCMEP as initially proposed by the governor in December of this year, we would most likely not be able to use, we would not be able to bring on a new provider. We would probably extend existing contracts for a period. As the legislature changed that proposal and pushed the timeline out for CCMEP to July, and as they changed the scope of that project to be initially focused on youth, and then in the first to 6 months expand to all adults, the legislature changed it so that that CCMEP program only focuses on youth. We still have an obligation to continue with our existing services. And so we made the decision to move forward to award off that procurement, and Maximus was the highest scored proposal. I'd like to talk just a little bit about policy changes because I think they are relevant. Want to recognize the state, and the governor submitted a waiver to the federal government requesting some policy changes as it relates to the TANF program and the cash assistance program that is referred to as Ohio Works First. The governor requested that moving forward, that program is no longer bound solely to the federal law that requires cash assistance recipients to work a certain number of hours each week. Those hours are calculated based on the number of children, the age of the children they have, as well as whether or not they have exemptions. And it limits, the waiver also requested that good cause leave can be managed differently so that a person can have good cause for not meeting hours, and can take into consideration illnesses and other life effects that could cause a person to not meet hours at a certain time. And then lastly, extends the opportunity for youth, for participants to go to school for a longer duration. The current law is participants can only go to school for a year and have that meet their work requirements. 1 year of school is great. Most people should be encouraged to complete college or a vocational degree or certification, as opposed to just doing 1 year. And so the governor's waiver proposal to the federal government is to have this program managed differently, allowing people to be more flexible in achieving the hours that are required of them, giving them some more flexibility in how they use their good time hours and then use education. Why that's important to the service that we're here today is this is one of the most significant components of our service inventory. Maximus will be providing our cash assistance recipients that don't have an exemption, aren't in school, with an opportunity to gain meaningful work experience. We have a network of providers that open their doors. These are businesses as well as nonprofits, and the county itself have professional opportunities where they take referrals from individuals that are receiving cash assistance, and they work with those individuals to do some of the work of that organization, be it scanning and copying, filing, breaking down products, preparing meals, managing soup kitchens. In exchange for that work experience, the individual meets their work requirements. And the provider, Maximus, manages both the network of vendors and organizations, as well as the reporting of hours of the individuals, and then also has some very interesting supportive services that we think will be of significant value. Let me say the last few things about Maximus before I open and see if you have any questions about what we're doing. So Maximus is a national and, in fact, international provider. We have worked with them in the past. They have been a provider of ours for intensive case management. By ours, I mean Kaga Job and Family Services. They were our initial provider, so we are well aware of them as an organization. They also provide this same service to states like the state of Nebraska. I did not get a specific reference from Thomas Pristo, our director of DCFS, but when Tom was in Nebraska, he worked with Maximus on his area, and I understand that they were a successful contract and had a good provider relationship. Maximus also brings in some real significant resources that are leveraged because of their work and the scale they are. They have integrated the Work Keys system into their program, and this is a program that is being used by Ohio Means Jobs, Cleveland-Cuyahoga County, Towards Employment, and some other providers in the community to determine what skills an individual has coming through the door. And so that instead of looking at them and solely saying, what are the barriers to employment, they can now begin to look at and say, what are the skills that you've had that are meaningful? What are your interests in using those skills, and what sorts of careers are you in pursuit of? And so I think Maximus has that, as well as some other very modern technology approaches to clients. And so our hope with this contract is that this will be an enhancement of our services because of what Maximus brings. And we hope in the end that that enhancement will play out to the benefit of our participants. We want them to have a good experience while they're doing work participation. We want them to be in a track moving towards a career. And we think Maximus can help us get there. And so I think I would open it up for any questions if you have on Maximus or our process.
Okay. The RQ to Maximus, you said there was a previous provider. So is this a new contract? Maybe I just didn't
Yes.
follow. It's totally
So,
new?
yeah, so we, through this day, through the end of next month, we are working with ResCare. ResCare is another national provider. They are actually the provider for this same service for Franklin County. And when we did a procurement for ResCare, we actually had time left on that contract. We did a one-year contract with options for additional years. I think ResCare has done some things well, and there's some things that we actually didn't feel like they were the provider for us moving forward. So we didn't exercise all of our option years, and instead put this procurement out to see if we could find a better provider.
Okay. I'll open it up to the floor now. Any questions? Let's go down the line. Councilwoman Conwell.
Through the chair to Mr. Merriman, what are some of the supportive services that you said that they provide, this Maximus?
To the councilman, I'd ask Bob to come up to speak on this matter as well. But among the things that they offer, they do have some cell phone and computer technology that sends reminders, that can be used to offer training and education to participants. They do have essentially an employee assistance program that would help people that are not meeting the rate, that are not fully taking advantage of the opportunity to assess what they are experiencing, and if there's a barrier, to help refer for that. And I think Maximus's approach on this is to take advantage of existing providers in this community. I don't think they're going to come in and have create a new mental health service provider. They would most likely rather make referrals to existing providers, utilize existing relationships. So it's both the soft skill development, as well as addressing educational barriers, as well as making referrals to the Human Service Network that can address a potential barrier. Bob, did I forget anything?
No, that pretty much covers it.
All right.
And how does this connect what Maximus does or correlate with the new County Executives Initiative?
It's a great question. So it will connect, as this will be a service that will be offered to anyone receiving food assistance. Cash assistance. What we're proposing with CAGA Works is very new and different. And I think that what Maximus provides and what the Work Experience Program is more consistent with our current model. So we are extending the current model while we design this new approach. And I can tell you that the focus of the new approach is a person coming into our system will be given an opportunity to work. And that opportunity will either be competitive work, or it will be in a work experience that may not have an income, but could immediately lead to it. And this is one of the areas that an individual could be linked to an employment opportunity that does not necessarily start with an income, but could lead to it. And if I can explain that just a little bit. So this contract primarily provides unpaid work experience. However, it does also allow for some supported employment where there are funds available to hire some of the participants to supervise other participants. So one of our hopes is that as time goes on, this program will be developed, and for example, as we use a provider to help do some of the county services in our office, there's a chance that we can find those individuals that are really doing a great job with the experience and give them an employment opportunity to help us supervise the remainder of the individuals. So in my opinion, that's part of the steps that we've talked about with Sharon, that an individual could come in, have no or limited work experience. They could be placed in an organization like the county's Department of Human Resources. They could place in an agency like JFS. And there they can begin to experience how scanning and shredding occurs, how document management occurs. And in time, hopefully, if this works out as we're proposing, they will be then given an opportunity to supervise some of the individuals around them. The supervision would be, great for their resume. They would be now receiving an income, and they would now be able to say this was a paid experience. I also think that it's valuable to them. This gives them, the experience of receiving a paycheck for that work, and hopefully shows them that they have the skills to work within our systems.
Thank you.
Councilman Miller?
Mr. Chairman, Director, how many people are currently on cash assistance in Cuyahoga County? And of that number, how many of those are required to meet work requirements?
I don't have the specific at this time. If I can use round numbers, so if we were to say there's around 7,000 individuals that are receiving cash assistance, I would back off that number. The first 5,000 are primarily kinship care situations. A family member is receiving cash assistance as they care for a child that is in the county's custody or has been provided to them as in a guardianship arrangement. So that gets us to 2,000. Of the 2,000, a great percent, anywhere between 1,000 and 500 and 1,000, are most likely on some form of exemption. They're currently pregnant, or they're in a postpartum period. They have a medical exemption that makes them unable to work at the time. That could be temporary. It could be in preparation for them to go on to ongoing disability. And so I would say our number is anywhere between 1,500 and 1,000 that are required to be doing work activity.
And Mr. Chairman, Director, how many people do you expect to be served by this Maximus program in 2016?
At a given moment or in its entirety?
They receive any service during 2016, total unduplicated.
Yeah, I want to say that we could expect to serve 2,000, but I want to confirm that with Bob.
Good afternoon, Mr. Chair. The program receives about 200 to 300 referrals a month. The average length of stay is about 90 days in a work experience program. So at any given time, we have about 300 to 400 folks that are active at any given time. And during that time, we work with about 350 to 400 different work sites where these individuals are placed at, gaining their work experience.
You said 354 work sites?
About 300 to 400 work sites.
300 to 400.
And those 300 to 400 work sites represent about 1,500 slots. So some work sites have, give you an example, like Metropolitan Housing Authority, CMHA, they have a number of locations. They have probably 25 or 30 different locations with 40 or 50 different slots that we place our individuals at could do housekeeping, they could do maintenance, they could do landscaping, they could do a variety of activities.
Do you have a closer number for those on cash assistance?
No, to Mr. Merriman's point, the folks on cash assistance that have a work requirement, today it's about 1,300, that are required. Now, keep in mind, this program also serves those folks that are on food assistance. That's the news population we served, if you recall from last year, what they the state so-called these able-bodied adults without dependents. So, while it's a voluntary program, but if they want to maintain their eligibility for, the SNAP assistance or food assistance, they have to be involved in what they define as an allowable work activity. Work experience happens to be one of those allowable work activities. So this contract will serve both those folks on cash assistance as well as those folks that are on food assistance that, are looking for an activity.
Mr. Chairman, Director, if you take the 1,300 and even you augment it by the 500 to 1,000 that have exemptions, it's a small number compared to the number in Cuyahoga County that are unemployed and have been so for a pretty extended length of time. My question is how are the rest of the folks surviving without cash assistance?
Councilman, it's a great question. Many of the individuals that leave cash assistance continue to receive food assistance, and they receive Medicaid, and sometimes receive child care assistance. So individuals that stop receiving cash assistance do not necessarily stop receiving services from us. In fact, it's increasingly likely that we will serve them for many years through Medicaid and frequently food assistance as well. What they do as it relates to an income is a very important question. I think it's something that is being talked about at the national level. There are kind of, it seems, weekly reports coming out asking that same question. I'll be honest, as I was driving here, I was listening to a story on a local public radio station about a book talking about $2 a day and how people are asked to live on $2 a day because that's what you get from many food assistance cases. So I don't have an answer to your question about what happens to people that are not in this program and are not working. I think it's an important question and one that the county is really grappling with. I think as we consider economic development, the top priority of the county, and I think as Armin has presented his vision for Cauga Works, you see that we're saying, moving forward, we have to work differently. Moving forward, we have to say that, this time in our program, the 3 years that we have to work with someone has to be meaningful and has to result in someone moving up the steps towards a job that actually gives them the resources to be out of public assistance if that is possible. If a person has a disability, then maybe there is still an opportunity to work and maybe there's still some need, but that's okay too.
Mr. Chairman, Director, final question. How many people bid on this contract?
There are 4 providers. 4 bidders, I should say.
And what were the selection criteria to choose this one over the other ones?
Mr. Chair, Councilman Miller, when we release an RFP, there's a whole scoring section, and we base upon the program model, organizational capacity, the budget, program performance management. So they're all going in with the same information when they craft their response to our proposal. And the review teams that we develop that review all the responses and score them, each of the responses, they're working from the exact same template. So so it's easy to compare apples to apples, and we rate all 4 respondents based upon their proposal, and we come up with a numerical score, and we recommend them based upon the numerical score.
And did ResCare bid on it?
ResCare was one of the respondents.
Okay. Okay, thanks.
Councilwoman?
Chair. My question is just for clarification. It looks like there's no levy dollars. This is federally funded? Mm-hmm. Okay. And are we clear on how long these funds are available, or how long have we been, the beneficiary of these federal dollars?
Well, to the councilman, the TANF program was reauthored in 1996, temporary aid to needy families. It replaced the aid to dependent families program. And it's a timely question. There is a lot of debate about reauthorizing TANF. And, as we said during the budget process, there is now bipartisan support to get into that. I think everybody recognizes that there needs to be some modernization of this program and this safety net service. Things like the work participation rate that allows people to go to college 1 year, but then says, okay, if you want to finish your degree, you should do that. You still have to give us 30 hours a week volunteering somewhere, or not volunteering, getting unpaid experience somewhere. That doesn't make sense for a person that's making individual decisions. I say all that to say there is the hope that TANF will be reauthorized. And it could happen in this next cycle, and I think there's a real possibility it could happen. But I think there's also, unfortunately, the reality that frequently those things don't happen, and they're extended for another year on a kind of an annual extension, and that's probably also very likely. In either case, the funds are made available based upon poverty, and unfortunately, we will still have need for the funds. And our relationship with the state is such that I don't have any doubt that if we were performing poorly on these programs, we would know about it from the state, and we would address whatever concerns exist.
Thank you. questions were asked and answered. That's it. Thank you.
Okay. Councilman.
Thank you, Mr. Chairman. Who's actually paying for the work keys testing?
This is a part of the Maximus contract. This is it's a service they brought in, and it's a component of what their proposal offered.
So if all 1,000, 2,000 people all want to sit for the work keys, they're gonna pay the ACT charge for the work key testing? No, Councilman. That's just part of the work keys they use as part of an assessment tool.
No, I understand. I understand how it works.
Yeah.
It's a paid product sold by ACT, I believe, is the owner of Work Keys. If you don't know, you really should. I'm sorry, but it's being used all across the nation. So who's picking up the tab for every one of those individuals who sits for that exam?
So our contract is for 1.3 million, and we have not gotten into the implementation, obviously, because we're still in this process. And I think as we move forward, we've made it very clear that we're interested in the work keys and would like to see how they would intend to implement it. I am aware that there is a cost, but Maximus proposed that this would be a component of their service, and we have to see who they would offer to and how. So it's something still to be determined.
So, I mean, let's just take an example. We have potentially 1,000 individuals we're talking about here in the model. And that I believe a work keys test is $35 to $45 to sit for that exam. So we ought to know clearly as to whether we're paying for that as an add-on to the contract, whether the individual who is hoping to get access through Maximus, or Maximus is building this into the price of what we're going to be sending them a check for. And that's...
Yeah, at this point, I don't think we've discussed any add-ons with them. That's not something that we would do. And I also would say I don't believe participants can be asked to pay for any portion of the service that they're receiving. So I think your question's fair, and I think as we get into the implementation with Maximus, we'll figure that out. We will learn as to when and who will be offered the test. But as I said, you know, it's a new provider, it's a new service, and a new way of doing an assessment for these participants that we've never looked at. And so this is a part of why our selection of Maximus, because this gives us the ability to get in alignment with other providers in this community that are using work keys.
Yeah, well, I mean, it's being used all over the country. Work keys, it's not a new product. It's been around for a long time. And ACT has multiple tests that follow on for other skills and disciplines in addition. I know Jobs Ohio uses it also, but they charge the individual, I believe, for that. So if somebody says, I want to be prepared to go into X, Y, or Z, they have to demonstrate their work keys capabilities, because I know we use that as a cut factor for people coming to apply for jobs for us, and a lot of people use it. So it's we got to figure that out, because you're looking at $35,000 to $50,000 on top of this contract, one way or the other, it sounds like to me.
They're not using work keys as a testing instrument. They're using some of the computer modules as a kind of a training component.
Okay, well, then, as somebody who's in the training business, that's not given away for free either. The training side or the assessment side, both are a charged products. We ought to at least figure out what they're doing. I mean, it sounds like we're relying on them using those things. They might be relying on us paying for those things. So it would be kind of an interesting thing to find out. Tell me about this unpaid work experience. How does that work?
So individuals that come forward, they have a range of programs that they can participate. Actually, if they're working, that can be their work experience. And they can still be, if they have enough children in their family or their income is so low, they could still be eligible, and that meets their obligation. If they're in school, that meets their obligation. They can do certain job search, job readiness activities, and many do that as well, at least at some point of the year, but then others do the work experience program. And so those individuals come into our organization, we do an assessment, we then make a referral of those individuals actually through Ohio, first to Ohio Means Jobs, and then following that program, generally, we refer them to this provider or whoever our work experience provider is. They then do an additional assessment and try to understand what the individual's goals are. And then the goal is to place them into a position that will ultimately lead to a job. And so that's where we have this 300 to 400 providers that work with us. Many of them, I think, expect to be able to get some referrals because they do play vital roles in those organizations. And on occasion, some of those placements turn into jobs. They turn into paid jobs and full-time employment.
Are these public employers, or are these public institutions, private institutions that the individual is working in a unpaid, like an internship? Is that?
Yeah, I think it's a great way to think about it, and that's some of where we want to go is either internship or apprenticeship, if at all possible. We're not there yet at this point. It is a combination of public and private, nonprofit and for-profit organizations that the individuals go and work in.
So what is Maximus going to be doing? Trying to find placements for the individuals?
Yeah, we have
They
a
have a
network
list?
of providers that work with us year in, year out. And so Maximus will get to know that network, and then they'll do assessments, and then they'll place individuals based upon availability of a placement as well as participant interest.
Okay, you have a network of placements or a network of organizations that will take a candidate? I'm trying to figure out what you're talking about here.
Our organizations that will take candidates are placements. Those are the organizations that we work with, and we set up some expectations for. If you receive one of these referrals, they're expected to get a certain number of hours, and then we're needing to get a report from them on how many of the hours the participant attended the experience.
A for-profit business or a government business? Tell me, so I have a better handle as to who is receiving one of these candidates, and then what kind of line of duty what kind of work they're actually doing once they get there.
Councilman, we call them work sites. Our work sites are a combination of, government agencies, public, private, nonprofit. These are organizations that we've reached out to indicate if they're willing to work with us to help serve some of our most vulnerable folks that have this work requirement under the federal government. Work experience is one of those federally defined activities that they can participate in order to maintain their eligibility. The number of work sites is very fluid. All right.
Tell me what it is. What's the name of it?
The work sites?
That's fluid. Tell me the name of a fluid organization so I understand.
No, I mean organization. When I meant fluid, that sometimes they need people to assist them with some of their work, and sometimes they don't. So
Just give me a name. Just give me it's ABCX. What's the name? Tell me one of these fluid organizations.
It could be May Dugan Center, Westside Community House, all the neighborhood family service centers.
fine.
All those nonprofit organizations. We have in our HR department here in the county. They have some of our work experience. Folks at our Halley building that we're doing some work with all the files there. Our work experience folks are there assisting them.
Okay, these are not paid.
These are unpaid. These are
Okay.
unpaid, and it's really for individuals who come in the front door that are applying for benefits that have a work requirement attached to their benefits. When we do the assessment, we take a look at what their life circumstances are and what we think will be the best, program to offer them. Many of our folks come in that have had no attachment to the labor force, have no work experience. They're not quite job ready yet. So the work experience program is designed to give them that kind of work experience, show up every day for work, dress appropriately, be able to respond to their supervisors. And then it's what we call a competency-based program.
But they're doing some kind of a task
Yes.
for that organization.
Yes, but they don't replace paid staff, because that's under the law. They don't replace, they're doing jobs that they're not replacing if people are on strike or union. They're not replacing anybody's jobs. That's
Where's
prohibited.
legal on this at this point in time? Because I know Department of Labor came down really heavily last year on unpaid internships, saying that, and even places like Disney and places like that could no longer do unpaid internships. They had to be paid. If we run this by and make sure that we're not going to get stuck because all of a sudden these individuals came back and said, hey, I'm doing work, I'm doing a task, I'm doing a thing, and they're finding organizations are having to write big checks.
They've reviewed it. The law department has reviewed it. And please bear in mind, this service is done nationally. It's done through in almost every county in Ohio, and as well as probably every state in America. So I think there are, as Bob mentioned, there are regulations on how many hours a person can work, what sorts of tasks they can do, and how they can be integrated into an existing workforce. But I can assure you that this is a service that has stood the test of audit year after year after year.
And I can assure you the Department of Labor changed the rules just last year because we're a recipient of that. We no longer have unpaid internships, even though it's beneficial to the college student or anybody else, because we've been told by council, do not do that, because there's a bill that will come due for organizations. I just don't want the county to get that same bill that's happening out there. And Department of Labor really came down on anybody doing unpaid internships. And I hope that we've got a legal opinion from staff that actually says that it's okay. It sounds like you.
I'll have to go back and see. I didn't personally.
Okay, all right, I
make
just
the
want to
legal
make sure,
opinion, but
because
I can try to
DOL
make
is,
sure that-
DOL has come in and said that, don't ask me why, I'm not a big fan of it, because I thought there was a really valuable thing for college students or anybody else to get work experience knowledge, but unfortunately, they've been somewhat curmudgeon as far as the way the DOL has changed the rules and that kind of stuff. They've changed them a whole bunch of stuff in the last 3 to 4 months. How about Employment Connections? Where are they in regards to this? Do they, because that's always also a county function as far as how do we coordinate with Employment Connection between the county, the city, and what they're doing for placement too?
Ohio Means Jobs, Cleveland-Cuyahoga County. The Employment Connections, I mean, I think that term has been just pulled back. So
Right, it
for the
has,
record, yeah.
yes, but-
So they're a partner of ours. Bob actually sits in on their partner committee. And every participant that comes in that is not exempt from the start, we make a referral of those individuals to Ohio Means Jobs. Now, unfortunately, not everyone goes, but our plan is that all of our participants will go through an applicant job readiness program through Ohio Means Jobs or Employment Connections. They'll spend 5 days with them doing some soft skill development, resume development. At the end of those 5 days, OMJ takes a look at them and says, some of you are work ready right now, and they offer them 5 additional days of the Ohio Work Incentive Program, where they then try to place them immediately in an open job that they're aware of. So following the AJR program, the individuals, if it doesn't look like they're ready for a job right away, they come back to us. But we continue to use Ohio Means Jobs as we identify that some of our individuals are in need of an individual training account. We refer them back to Ohio Means Jobs to use one of their existing ITAs for skill development. And so they're a partner of ours all the way through. OMJ is also housed in 2 of our organizations. They do resource rooms where they are open to any participant, anyone from the public actually, to come in to do job search, job readiness, and skill development.
If I can get those couple of questions answered as far as the work keys, who's paying for it, who's paying for the examinations, and then find out whether we've run it up as far as the internships, the unpaid internships, and as long as we don't have a problem with DOL, that'd be, I know that it has been going on for years, but so had Disney and places like that taken unpaid internships thinking that they were providing a value, and only to find out that Department of Labor changed the rules on us this year.
One of the aspects of the executive's new workforce development program that's budgeted this year is advocacy. I was happy to see that. In fact, I had talked with him about my own interest in that. We know a lot of the barriers are at the state and federal level to those receiving cash assistance. So any changes that you can have at the state and federal level, as the councilman has just said, they're changing their laws annually. Does this contract tie in at all with what the executive has budgeted towards his workforce development program, or those 2 separate things?
Yeah, it absolutely ties in as a part of the standard of care. This is a service that we would offer to all of our cash assistance recipients. I think the distinction here is that, if I can just, for background purpose, Bob Math and his group has historically been very focused on having individuals move to employment as a requirement of our system, not a policy requirement, but something that we're all committed to. Unfortunately, as we received more attention and there was more focus placed on work participation and meeting the rate, we actually took our eyes off of leading people to employment, because in the eyes of the federal government, you're either meeting the rate or you're not. And so the state then took that on and told every county, you either meet the rate or you don't. And I think in
What does
ti-
that mean? If you meet the rate or you don't, what happens if
so
you don't?
50% of your participants that are required, that are eligible to do work activities have to be doing it.
Right.
And you know, and at times our numbers are 50%, at times they're 48%. It goes up and down. And
No, what I heard you say sounded like an ultimatum. You meet it or you don't. What happens if?
oh, we
what does
were,
that
the
mean
state
if
was
you
under
don't?
threat of sanction from the federal government. And the federal government was saying either as a state, get your rate up above 50%, or we could sanction you. We could reduce the grant that you get from us. We could require that you spend more of your own money and you essentially purchase the rate. And so everybody got very compliance focused for a period. And I think in getting compliance focused, kind of to Councilman Miller's question, we focused on the denominator frequently. We focused on how we can reduce the number of people that are not meeting the rate, but not really understanding why. We never, and this is the point Armin's making. I mean, someone's coming to us and they're saying we have no income, and you know they need cash assistance, and we start to work with them and they don't do the activities they have to do. A compliance focus would say you're out, you get sanctioned and you're done. And if no one takes the time to understand really what's going on. Now we have sanction activities that we offer to these individuals, but if we don't figure out how to address whatever barriers are preventing them from meeting the rate, most likely those same barriers are going to show up and they're going to prevent them from working. And so Armin's approach of providing some more in-depth, comprehensive services that we expect Maximus to be a part of is to look not just when we succeed, what those successes lead to as it relates to employment, but when we are not successful, what's the cause of that? Why is somebody not showing up? Why can't they follow the direction of a supervisor? And how can we address that? And that's the expectation we're going to have of Maximus and all of our other providers. It's not just about getting the person in the right place at the right time. It's making that time valuable that leads to a job.
So what I'm hearing is or tell me, is it fair to say the impetus of this contract is since the state is really saying reach that 50% goal or not, this contract and the new provider is to really help the county reach that 50% work participation rate.
It is. But I want to be fair to the state in this, in that, you know, we wrote this into our service inventory. It's something we've done for years. We always intend to have this as an option for clients. The state's decision to request a federal waiver, and please know, they're the first state in America to request it, and the only one, to my knowledge, at this point. So they're way out ahead of everybody, and they're saying work participation rate, as it currently is written, does not make sense if our goal is to get people into jobs that lifts them out of poverty. So I think when we proposed this service, when we created our inventory, it was to meet the requirements of the law. But I think as we all look at what we're doing, we realize we are focusing on compliance, not on outcomes. And what we really need to do is to move people from our front door where they have no income, no resources, into a professional experience, and from that professional experience into a job that pays them a competitive rate, and then hopefully into the next job that then moves them closer to the line where they no longer need public assistance.
So this contract offers also work training or work experience, unpaid work experience that would allow the county to count those numbers towards our 50%.
Yes.
Okay.
Yes.
So they're not actually getting a job, they're getting training.
They're not in the
those
competitive.
areas
They're
that
not in the
Bob just
competitive.
mentioned,
Yeah.
similar HR for the county. And
They're not in a competitively paid position, but they are in a professional environment getting work experience.
how long have we actually done that? Put people in those positions you mentioned, Bob?
Councilman, we've been running the work experience program. Initially, the program was run through the Department of Workforce Development many, many years ago. Then at some point in time, the decision was made to bring it into JFS. The work experience program in our community has probably been around for 15, 20 years.
15, 20 years.
Yeah, and keep in mind, the work experience program is not a job, it's not a job play. This is a federally defined program. This is how they define it. It's an unpaid work experience. It's not a job placement program. The way we've developed the program and how we want the program to evolve is it's competency based. So if somebody's in the work experience program, when we see that after a month or 2 months they're doing well based upon their attendance, you know, a number of other metrics that we review in terms of performance, you know, how well they're doing on the job. And then we move them out of the work experience, we put them in a job placement program to get them a job. So, where in some counties, that's the only program they have is work experience, and they let them languish there so they can be there for all 36 months they're eligible for cash assistance. And then when the 36 months is up, oftentimes these participants are in the same situation they were when they first started.
So we've done this for 15 to 20 years, and it's not a work training program per se, but the county has credited towards our 50% goal. Over the 15 to 20 years, how many of those individuals have actually gone on to find genuine employment within those HR here at the county? How effective has that been? Even though we've gotten the work participation rate credit for it.
Yeah, as I stand here, I can't answer that question. As I stand here, I can't answer that question. What I can say that about 10 years ago, we worked with Case Western Reserve University to look at our program, to look at welfare reform. What they were doing is they were actually tracking when a person leaves JFS. They leave either because they've completed their time in the programming or they've been sanctioned out. And what Case found is that when a person leaves JFS in a sanction, when they lose assistance through a sanction, they haven't done what is required of them, they frequently go back to the same conditions that they were in before. When a person leaves JFS with a job in hand, they frequently do better. Now, frequently keep those jobs. Unfortunately, that contract and that service with Case was limited, and we haven't looked at the same numbers in 5 years. But I will tell you, I met with Case last week with Claudia Colton and Rob Fisher, and I said to them, listen, I'd still like to answer that question right now. I'd like to know what happened, not just to our clients today, but 10 years later. What happened to those individuals? How did it turn out? How many of those that left with a job went on to get a better job? Or unfortunately, how many of them got in jobs that were dead-end jobs? Maybe they're still in them, and that's okay. Maybe some of them came back to us. So I think you're asking a great question, and unfortunately, I can't tell you. And I have to recognize we have very limited data integration between what we do with Ohio Means Jobs and other centers. And so I think it's a smart question and a valid one, just one we're not prepared to answer.
Right, we have to look at those things, because what we don't want, and I'm not saying this is because I don't know enough about it yet, but what we don't want is to have a goal that we have to reach, and we put a Band-Aid on things in a way that aren't really serving the people. We meet a percentage goal, but the people in the end aren't working.
Yeah.
They aren't working. And I don't want to sound like a broken record, but I just keep coming back to the fact that I've been in Towards Employment office, just touring, and a room of 50 young individuals being trained. And I simply asked them one question. I said, how many of you are interested in going to business for yourself? And 2/3 of the room raised their hands. Self-employed is one aspect of the ABOD box you mentioned. A person who can check off being self-employed can maintain their cash assistance, their food assistance. That's what it was referring to at the time, food assistance. It's a viable option, and it's not simply a viable option. It's one that many people need. When someone has a felony on their record that's part of this demographic, and there are some additional barriers to employment, I believe you should have both. You should have a job and a part-time business. And we have an opportunity to do that. We have ECDI contracting with the county. Their ability to provide training to an individual with no barriers if they so desire, and then can still maintain their assistance. To me, that is just a simple pathway to allow, again, I don't know the rules. I would like to believe that allows for workforce participation, qualification, but it certainly would allow them to maintain some minimum benefits that are offered by the federal government. But that needs to be incorporated, because that's just how I feel about that. So, but I'll pause and allow Councilwoman to ask a question.
I have 4. Through the chair to Mr. Merriman, you mentioned individuals off of cash assistance, but some of them remain on food assistance. Is there an increase in the food assistance once they're cut off of, because they have no income at that point?
No, they're to my knowledge, they stay at the same level they were at, and so there's not to my knowledge, I'll confirm this and I'll let you know if I'm incorrect. Whatever they were receiving when they went on, let me back up and say most most people that go on to cash assistance are already receiving food assistance. They then have a life-changing event. They lose their job, or they're an ABOT and they're on cash assistance, and they get pregnant and they come on to, they're on food assistance and they come on to cash assistance. And so they maintain their food assistance, they get their cash assistance in addition, and then once they lose their cash assistance, they're still eligible for their food assistance.
But that doesn't increase though.
It doesn't increase, and it actually can decrease. I think when we talk about individuals getting jobs, if you get a job that will actually contribute to your household income, then you may actually get less food and cash assistance. Now, you hopefully get you net out more. You get more by working, and we see that. But for many people, it's a pretty thin margin between the two.
How many of the providers or bidders were in this state and county?
So 3 of the 4. Well, so when you say if you're saying headquartered in the county, 2 are in the county. ResCare was already here, and Maximus has already had a provider relationship with us, as well as many other counties in the state. Only 2 of them are headquartered here in Cuyahoga County.
Okay, and that was ResCare and Maximus?
No, ResCare and Maximus are not from Cuyahoga County.
Okay.
2 of the other providers are county. It's Goodwill and Catholic Charities.
Okay, a reason we didn't go with that?
But it was a competitive procurement. Chose the proposal that really met the county's needs.
Okay, and how long you mentioned the implementation stage for Maximus. How long would that implementation stage be?
Yeah, so the service, the end of the year, and the service that we currently do closes the last week of December. We expect them to be open up and running the first day of January that we're open.
Okay, so they're transitioning right now,
Yes, they're not under contract. We're not paying them anything.
but they need to be up and,
But we are going to ask for passage in 2 readings to give them a little bit more assurance that the work that they're doing is valuable, and we're moving closer to that contract date. But they're working with us right now, even though we're not paying them.
so what will happen with ResCare at that point? We're just stopping with ResCare
Yes.
as they're booting up, or we're allowing them to?
Our contract
I don't know what
yeah.
you're talking about, implementation stage, and what
Yeah.
that consists of. Does that mean computer or program or?
The first day, the morning after the end of year holiday, lights go on. We expect that Monday for Maximus to be there to receive clients.
Okay.
If I can offer just, from the participant's perspective, it'll be very transparent. They won't see any difference. I mean, if they're assigned to worksite on December 31st, and that worksite continues until January 4th, excuse me, they would just continue to report to the same worksite. So the worksites would just be dealing with a different face, if you will. Instead of dealing with staff from ResCare, they'd be dealing with staff from Maximus. So the transition will be very smooth. There will be no gap in service. So when ResCare's contract ends, another contract comes into place. And it's not the first time we've changed providers at the end of a contract year. It happens frequently, and we're prepared and we're equipped to deal with those kind of transitions.
Well, I just know, I sit on Public Works, and we usually, when there's a competitive bid process, we want to see a lot more as far as openness and transparency when it comes to contracts, and not to say that the county only hires from Cuyahoga County, but that has been always the main focus or position that we've tried to implement. Support your own, kind of. So I don't know what happened in this contract, and I don't know if you could send us the bids. Usually those are included when it comes to Public Works.
I think we
The
have the
different
summary comments.
providers are,
I think that was in the Novus. It should have been in the Novus packet. The summary of the comments from the RFP were there. They should be in Novus. We'd be happy to give you those.
yeah, it didn't get in the book. So I just thought that was overlooked from HHS, so that's what we're used to. My last question would be, could you provide this committee with the breakdown of how many men versus women are in this work experience program?
Yeah.
So with Maximus Human Services overseeing a network of nonprofits, okay, what would it take for, again, Economic and Community Development Institute, ECDI, the organization that does our county's small business loans, not financial literacy, but small business financial acumen, teaching the residents of this county how to go into business for themselves and be successful. What would it take for, or is it possible for an organization like that, this organization, to be added to the network that Maximus oversees?
Well, I think, Councilman, I would have to know more about what the goal of that, of adding them to that network is. If the goal is to give some of our participants work site opportunities, I think that's a conversation that can occur between them and ResCare, and we can facilitate that if the contract's approved by council. If the goal is to have an entrepreneurial workshop be a part of the work sites that are offered, I think that's a separate service. That's more of a job search, job readiness, job placement. We'd have to go back and see if the federal rules allow for that sort of work to be counted towards the work participation. And I think, as I've said before, we're very interested to look past the work participation rate. We also have an obligation to work on it. And so we're trying to manage a balance here of doing the best we can with the rate, but also trying to do the best with the opportunity to the individual. So I think as we move forward, if you want ECDI to sit down with Bob or with ResCare and explore if they can also participate in that, I think that's fine. I would have to hear just more about what kind of the goal of that partnership would be and whether or not it's feasible.
I'd like to see that happen, because if you presented two pathways, so if it fits into your existing parameters, that's a good thing. If it doesn't, then I think it should roll up to the advocacy part and see if there's a waiver that could be received to make it happen. It's a needed service. It's a needed service.
And to be clear, we have many people that are self-employed that are receiving benefits, both cash and food, Medicaid. It actually is it's a harder thing for us to work on because of the reporting of income. So they're a little bit more difficult cases, but we work with many people that have landscaping businesses, that have computer repair. I mean, there's a lot of that out there.
That's
So
why I envision ECDI coming in, actually helping them,
Yeah.
tailoring it to where you help them to meet the reporting requirements of the financial assistance that individuals get. So that's actually where I was going.
I'd be happy to take that meeting once, if the contract is approved and ResCare is available, we're happy to have them sit down with Bob Math.
You said ResCare, or did you mean Maximus?
I'm sorry, Maximus, excuse me.
Right, okay. All right, any further questions? If not, well, I'll make a motion that we move this resolution to the full council. Does it need a suspension, or?
It would be of benefit to the transition to have it passed in 2 readings, just as we get to the end of the year, and we would like to be able to give them the assurance, move forward, start hiring people. This, I think, would show them that we've cleared legislative hurdles and they should be making commitments.
Under second reading suspension.
Second.
Moved. Any discussion? Councilman Miller.
I'm happy to vote for second reading suspension, but it's on the understanding that I would like to receive something from the law department in response to the question that Councilman Schron raised about the unpaid internships before next Tuesday when we have to vote on it.
I think we'll work on that with law. If I recall, law did look at internships when we were looking at how we use them within the county. I don't know if it was specific to this work experience program. So I think I could work with the law department to take a look at it, and we'll see what we have.
Is that enough time? Do you think you can do it before Tuesday?
I also think, I think there's a kind of a fine line between what's the terminology of internships versus work experience. I'm not an expert on internships, but there's a fine line, there's a difference there. And what they're doing is work experience.
I agree, and that's why I think you're going to be okay. But I do want to get something from the law department to provide assurance before we do the final passage.
Well, and just in the event that we can't get all of the documentation in by then or the following meeting, I just want to assure council this service is being provided statewide and nationwide. And, you know, if there are some, if these policies are at odds, it's between the Administration of Children and Families and DOL. And, you know, I think our intent here is to maintain a service that's important to our participants.
Okay.
When you said that, it made me think, in our disparity study, there are national companies who do disparity studies. And just because they're national, doing it all over the country didn't make them, we were able to bring something far better than what the national vendors were providing. Is there an evaluation performance for this contract, for this company, what they do? Do we measure their performance? And for Rescare in the past?
Yes.
How do we
Yeah.
measure their performance, and who does that for us?
We look at multiple metrics, and what I would just recognize is we're here today because we did that evaluation, and we felt like our previous provider, you know, although they did some things well, they were not the provider that we needed to move forward, and we made a decision based upon that. So we evaluate, and we hold them accountable for what they proposed in their proposal, and based on it, we are very comfortable making decisions to switch partners. And there will be ongoing evaluation of this one as well.
So it's really just done internally by your department, the performance of?
We, in all our contracts, we build in, we have a program, we have something called comprehensive program assessment, where every single contract that we enter into goes through that comprehensive program assessment. It entails case file reviews, where we go on site. It involves, you know, site visits where we have to actually observe the classes, we observe the orientations, we meet with the participants, we review their paperwork. They have to give us monthly reports and quarterly reports. So it's a fairly stringent evaluation process that we go to. And to Mr. Merriman's point, Rescare did a credible job, but, you know, but credible wasn't, we need to take it up to another level.
50%.
More than
Whatever.
More than.
Right. Okay.
And this is just for 1 year, correct?
What we're proposing here is the first year of the contract, and we'll see how it goes from there.
Go right ahead.
Can I request that, once you do your evaluation of this year, since it is like a new company that we're going with, that you come before this committee and let us know, you know, what the matrix, how they compared with your recent documentation, and do you feel that we'll move forward with them or give someone else a try?
Absolutely. If the relationship works out well, then when we come before you to request an extension and amendment of the contract, I feel like that'd be a great time for us to talk about the previous year and what our findings are.
When would you speculate discussing an extension? 9
Well,
months in?
Yeah, well, so county process requires a certain amount of time
Right.
to move through the different steps. And so Bob's team is, I think, one of the best teams in the county at managing that process. And so they start to make that decision 6 months out and start to look, okay, unless the wheels are off the bus at this point, we're going to move forward. You know, I think you have to assess quickly. If it's a total mismatch, then you have to act even quicker than that. We don't expect that to be the case, otherwise we wouldn't be here with them. But we do, we do start to look at making the decision at least 6 months out. Okay, are we going to move forward? If so, we need to request a contract amendment. We need to have it go through law. We need to get it into Novus. We need to get it from the provider. We have to get into Novus. We want to adjust for enough time to have it hit a council or board of control meeting, and if necessary, get all of its readings and still have time for a potential delay. So that's why we do tend to look 6 months out.
All right. You know, I would like a presentation on this at some point. You figure when
Absolutely.
halfway into the contract, or maybe even less, sometime, just to get a sense, and maybe even bring Maximus Human Services in, their local, you say it's a national company, their local representation in, and hear from them as well.
Okay.
Mr. Chairman,
Councilman?
how many extensions are provided for, and how long are they?
When we, Councilman Miller, when we issue the RFP, because of the way the allocation comes, we can only issue it on an annual basis. We build into the RFP the possibility of 2 one-year extensions, but it's strictly based upon performance, agency need, and funding availability.
That's typical.
Yes.
Okay, thank you.
And I would like to have follow-up on the ECDI aspect, if there's any, if that's a viable option or not.
Okay.
Okay, it's been moved and seconded. Is there any further discussion? If not, all in favor say aye.
Aye.
Aye. Resolution is approved under
Thank you.
second reading suspension. Thank you.
Thank you.
Is there any miscellaneous business?
And that's moved on the caveat they're gonna get us, okay.
And again, yes, the caveat that we have a response to Councilman Schron's question. All right. Chrissy, has anyone signed in for public comment?
Yes, Mr. Chair, Ms. Lou?
Good afternoon.
Good afternoon.
Thank you. The first thing I say, I really enjoyed this particular resolution. All of you asked good questions. Even I learned a lot. I have no background knowledge of this. I have heard of it, but now I really know. And this is the same thing, just like I would like to thank our council lady, Conwell, again, because she's the only one up to now making an effort to really visit us. Homeless Congress meeting and even Norma Her Women's Center once. I would still like to extend that invitation to all of you, but please come in to spend a little bit longer time. You know, you can start from a dinner time, you know, a couple of hours longer, so you will see a more realistic daily life in that place. All right. I know this will take out your time because you guys have all kind of meeting and appointments to go, and I can really see what happened with all our budget meetings, you know, for the whole county. The strange part I found out is we have a $60 million for a sports complex. Renovation is important, but at the same time, all the budget for homeless services got cut, unfortunately. Same thing with Syntax, for example. Part of it may go to arts programs to benefit certain people related to that, but same thing, there's no tax. With a designation note saying partially it will go to homeless services. So I will address that and for you guys to see if there's any way we can improve that part. Otherwise, we have to wait for donations or we have to go to another county to get some mattresses or to get certain things done to improve our homeless services. That's pretty sad. But the last not least, I have to thank you, all of you, to make an effort. We got funds for ID collaborative. So the next 2 years, 9,000 homeless people will be able to get their IDs. That's really important. And I really have to thank you for that. But meanwhile, we still have a single homeless individuals or homeless families still getting misleading informations to cause the misleading result of the diversion program. So I would just like you to be aware of that too. Thank you very much.
Thank you. Chrissy, has anyone else signed in for public comment?
No, Mr. Chair.
All right. If nothing else holds our attention, then our meeting is adjourned.